Medication administration is a way of relieving symptoms and helping clients drive towards recovery. For clients with mental illness, psychotropic medications such as antidepressants, antipsychotics, and anxiolytics can help to relieve their symptoms. These classes will all be discussed in some detail throughout this video. As people with mental illnesses are often vulnerable, it's important that the nurse approaches the situation carefully, ensures the client and their family understand the reasons for the medications ordered, and address any concerns or queries necessary to put the patient at ease and promote adherence. This is facilitated by the development of a therapeutic relationship where the client and nurse work together in order to achieve positive outcomes for the client.
Selective serotonin reuptake inhibitors and serotonin noradrenaline reuptake inhibitors block presynaptic neurons from removing serotonin and noradrenaline from the synaptic cleft. This allows for a more prolonged activation of the postsynaptic neuron, which will assist in controlling arousal, sleep, mood, appetite, hormone release, body temperature, behaviour, pain transmission, and emesis, many functions which are altered when a patient has been diagnosed with an illness these medications are used to treat. These include major depression, where they are used as a first-line treatment, anxiety disorders, and eating disorders. These medications have many side effects, now listed on screen, which are one of the reasons for medication non-adherence. On screen now are the dosages for a range of selective serotonin reuptake inhibitors. And now serotonin noradrenaline reuptake inhibitors, which are all taken orally, usually daily. Tricyclic antidepressants have the same action as selective serotonin reuptake inhibitors and serotonin noradrenaline reuptake inhibitors, and the same indications for use, however have more major side effects associated with them and hence are a second-line treatment. Here are some of these effects. Again, similar to SSRIs and SNRIs, these medications are taken orally, usually daily, doses as listed here. Monoamine oxidase inhibitors inhibit two enzymes, monoamine oxidase A and B, which usually metabolize serotonin, noradrenaline, and dopamine in the synaptic cleft. In addition to the effects of prolonged exposure to noradrenaline and serotonin, as with SSRIs, SNRIs, and TCAs, prolonged dopamine exposure leads to alterations in skeletal muscle control, behaviour, emesis, and hormone regulation. This added action creates some additional major side effects as listed, and hence is a third-line treatment for major depression. The half-life of these medications is shorter than other antidepressants, hence the medication is often taken 2 to 3 times a day in doses as seen on screen.
Antipsychotic drugs are mainly used for the treatment of psychotic disorders. Psychosis is defined as a condition where a person experiences distorted cognition and social interactions with impaired emotional and communicational responses. Affected people typically experience hallucinations and delusions. These symptoms are described as positive, being something that is experienced by the patient, as opposed to negative symptoms where they show little emotion or no motivation. Psychosis may be experienced by many mental disorders such as schizophrenia, major depression, and mania. Antipsychotics are indicated for these illnesses whether they're acute or chronic. Antipsychotic drugs can be classified as typical or atypical. These are first and second generation drugs. Typical drugs work primarily on the positive symptoms, whereas atypical work on both positives and negative symptoms. In general, antipsychotics take effect by blocking dopamine transmission in various parts of the brain. This is achieved by inhibiting D2 receptors. Dopamine is related to behaviour, cognition, attention, mood, and learning. Influencing these factors will ultimately have great effect on psychotic episodes. Improvement should be noted approximately 6 weeks from commencing treatment, though it will take months before the full effect is achieved. Many patients require maintenance doses to manage their illness and promote recovery. There are several variations of antipsychotics for different drugs and patient conditions. They may be administered orally in a tablet or liquid form, by injection or wafer. Some injections may be long-acting, being beneficial for patients whose symptoms limit their abilities to take regular medications. Drugs commonly used include olanzapine and risperidone being second-generation drugs, with haloperidol being a well-known first-generation drug. Olanzapine oral dosages for schizophrenia are typically 5 to 10 milligrams. This is then increased gradually to a maximum of 20 milligrams. Many benefit from the higher dose, though the adverse effects are increased. Dosages of haloperidol for chronic psychosis is typically 3 to 10 milligrams daily. As with all drugs, there are side effects included. First-generation medications tend to have more serious adverse effects than the second generation. Common side effects include weight gain, sedation, agitation, constipation, nausea, decreased sexual function, and hypertension. Rare and potentially life-threatening side effects include neuroleptic malignant syndrome, cardiac arrest, seizures, and anemia. Not all of these outcomes can be reversed.
Anxiolytics are medications most commonly used in the treatment of anxiety. However, are broadly used in treatment for adjustment disorder, depression, stress, and some types of insomnia. Anxiolytics work by causing a specific agonist action at central receptors, enhancing the effects of the neurotransmitter GABA. The neurotransmitter stimulates feelings of calmness and relaxation by inhibiting nerve transmission in the brain. The inhibitory effect on motor neurons slows down nerve impulses throughout the body. Therefore, anxiolytics are also used for sedation. The full mechanisms of action for these drugs are not entirely understood, and there are suggestions that actions at serotonin levels also take place. Anxiolytics include several families: benzodiazepines, hydroxines, and other carbamates. Some of the more frequently prescribed anxiolytics are the benzodiazepines, such as Xanax, Valium, Atrovan, also known as diazepam, alprazolam, and loraprazole. Due to the inhibitory effect of the central nervous system, some common side effects include drowsiness, difficulty concentrating, decreased alertness, confusion, hypertension, changes in concentration, respiratory depression, muscle weakness, headaches, and changes in libido. Physical and psychological dependence, which may cause withdrawals or rebound upon discontinuation of treatment, is also a high risk factor. Dosage and analytic drug type are very important to help limit these side effects for individuals. Methods of administration vary greatly depending on the purpose of treatment. The most common method of administration is tablet or capsule form. However, the majority of drugs can be given in various ways, such as diazepam, which can be given orally, intravenously, intramuscularly, or PRN, depending on the cause and other affecting conditions. Due to the risk of drug dependence, most of these are short-term treatments and patients are slowly wound off them. Therefore, correct administration and patient education is extremely important when dealing with anxiolytics.
The nursing role in medication administration is vital, and the Fundamentals of Nursing textbook provides 6 key steps in order to produce the best outcomes. Number 1, identify the patient using 2 identifiers, for example, name and date of birth. Number 2, inform the patient regarding the indication, action, and possible side effects of the medications, and answer any queries or questions. Thus, the patient will feel more comfortable with the medications and are more likely to adhere to the regime. 3, administer. The medication should be administered after it's been checked according to the 6 rights of medication administration: route, drug, patient, time, dose, and reason. Number 4, adjunctive intervention. Other interventions such as relaxation therapy, reassurance, and manipulation of the environment can be used to produce the best outcome. 5, record. All medication administration information should be recorded on the drug chart. 6, evaluate. In working with the client, the medication therapy should be evaluated in terms of its therapeutic effects, side effects, and possible continuing concerns of the patient. Adherence is a big problem for those with mental illness. Non-adherence is where a patient doesn't take their medication as prescribed and can lead to readmission to hospital or relapse. It can also lead to slower resolution of symptoms, leading to health professionals believing the medication isn't suitable for the client, leading to unnecessary medication changes. Non-adherence can be the result of side effects impacting quality of life, lack of education about the illness, and lack of education about the medications. Thus, it is vital that clients receive adequate education about their condition and the medications they'll be on, and the aim behind them. It's also vital that a therapeutic relationship is in place in order to allow the client to feel comfortable to report on difficulties in their management of the medication instead of just stopping them completely. Medications are an excellent way to reduce the severity of symptoms of a patient experiencing mental illness. They can provide a patient with a better quality of life and help them work towards recovery. It's vital that the patients are appropriately educated on the medication regime and that any questions or queries are addressed in order to promote adherence and avoid adverse outcomes.